I know that people like Ozempic because it gets rid of that food noise, but again, that's telling a story, right? If you are having cravings because there's a nutrient deficiency, silencing that food noise does not fix the underlying issue. Silencing that food noise does not fix your issues with cortisol or
Mhm.
hormone imbalance. So, really just trusting that your body is telling you something and not trying to silence your body is the best course of action because when you come off these medications, not only have you slowed down your metabolism because you're not eating as much, now you've come into this muscle loss phase. When you start
Mhm.
eating at a slower metabolism, there's rapid weight gain, and you're not gaining back muscle. You're getting back
Right.
fat. And so you're actually worse metabolically than when you first started. And so I'm really not a huge proponent of these medications.
Yeah, I agree
Yeah.
with you. I do use them obviously, but our use case is a little bit different because, in integrative cardiology, holistic cardiology, we are trying to lower inflammation and specifically lower the impact on the heart, right? And there are quite a few patients who essentially have deposits of fat, not just in terms of their belly, what we can see, but actually surrounding the heart itself and even surrounding the heart vessels. So that's why a lot of data that came out, for example, from semaglutide trials, was showing improvement in cardiac outcomes that were not necessarily driving one to one with weight loss because there was a loss of fat, sort of remodeling of this adiposity in another location that was important cardiovascular. But what you're bringing up are very valid concerns because typically we do modified regimen. I think it's more colloquially known as microdosing, and that's essentially to allow to mitigate the side effects and just as you said, switch the pattern, listen to the body, switch the pattern, have a lifestyle intervention that becomes the foundation upon which one can build further things that are a little bit more, I guess, interventional or more aggressive, right? But without that foundation, you can't really have a sustained success.